Talk now to public health expert Dr. Adegbami Oluwatobi, who joins me live from Lagos for more on this viral disease called hepatitis. Doctor, so government is saying nearly 20 million Nigerians are infected. Just how burdensome is this figure relative to other infectious diseases?
Okay. Well, the burden of hepatitis is huge. And then it's huge because hepatitis is referred to as a silent killer. All right? It's a silent killer because those who are affected by it, most of them don't know until it is too late. All right? You probably not get no symptom, no sign until it has degenerated. It's a silent killer because it can be passed from mother to child. All right, a child that was brought into this world, if the mother is unaware, hepatitis could be passed down to the child. It's also a silent killer because a safe and effective vaccine has been available around the world for more than 4 decades. Still, one person dies every 30 seconds from an hepatitis-related infection. That is according to the World Health Organization. So I cannot see a bigger burden for an infectious disease, but for hepatitis. That's why I think that the awareness is low, and a lot of work needs to be done to get people sensitized to know their hepatitis status and take steps towards prevention and safety.
Talking about low awareness for the silent killer, just how do you know if you're a carrier, if you have hepatitis? What must everyone do? Are you
Now,
recommending a periodic test in this regard?
Yeah, okay. So now, if you don't take a test, you wouldn't know. All right, you would not know for a very long time until it has degenerated. All right, now the liver has so many important functions in the body, and when the liver, when hepatitis affects the liver and it goes from liver cirrhosis to liver cancer, all right, and then the liver failure eventually, and the liver is unable to function. Eventually, if there is no liver transplant, it leads to death. Now, if you do not carry out the test, there's no way to know early enough to make any step towards prevention or to make any step towards treatment. So early testing and awareness is important in curbing hepatitis.
I'm wondering just how often one should take that test. But I also want to ask you, this year's commemoration talks about bringing hepatitis care close to you. How equipped are our primary health centers? How adequately equipped are them to be able to provide care for people who have this challenge?
Okay, so I would like to just spin that around a little bit. So it is, even when the primary healthcare centers are equipped, the question is, do our people come around for regular tests? Okay, most Nigerians don't go for regular checkups unless if there's a problem. They're already feeling the pain, the fever, or the general body weakness, and then they need a solution. That is when they go to the hospital to run any check. Oh, what is wrong with me, doctor? All right, but for hepatitis, trust me, we are assuming that people will not come to us. This year, we are taking the hepatitis campaign to the people. Okay, that is why if we look around Nigeria today, we have been able to, push a lot of outreaches around the communities, all right, markets, religious grounds, corporate institutions, partner with several NGOs to push, this awareness of hepatitis. And I'm proud to say that Emza Pharmaceuticals sponsored free screening all around the country. I'm sure we've gone more than 20 to 30,000 people year to date, all right, free screening for people to at least know their status and then make a decision towards prevention and safety.
Since for hepatitis. I'm asking if there are vaccines for hepatitis.
Yes. There are vaccines for hepatitis B, especially. All right, the vaccine for hepatitis A and hepatitis B, and then more common in our region is hepatitis B. The vaccine is readily available and it's very cheap in most of the hospitals. Okay, now for the the Nigerian government, in collaboration with Gavi, has been able to provide the hepatitis B vaccine for children. Now, every child being born has to take that vaccine within 24 hours of birth. Okay, but it was introduced in Nigeria in 2004. But what happens to the adults that were born before 2004? What happened to the children that the awareness of hepatitis did not get to their parents in the early years of their birth? Okay, so how do we begin to get that information to them that even though they are not kids anymore, it's still important for them to get themselves and their family members, the people around them, protected? So that is why the awareness has to be continuous. And I would say that, community leaders need to begin to support this movement, increased awareness among our healthcare practitioners.
Indeed.
A lot of us.
Indeed, Doctor. It's a good place to leave it. We'll be back with you for more. Public health expert Adegbami Oluwatobi, thank you so much for sharing your thoughts on this topic.
Thank you.